Where we have the missing tooth.
Radiologist Dr. Paul Gostner is soon able to see just what ailed her. A tumor near the abdomen.
She was in pain, mainly because this malignant tumor had destroyed the bone. And this is a sure sign it was malignant.
But that wasn't all. Hatshepsut was suffering from many ailments. She had arthritis, osteoporosis, perhaps even diabetes. But none of those did her in, nor was she murdered by enemies. What killed her was something far less sinister.
In the last months of her life, an abscess formed in her mouth, and the pain was so great that during her last days, she wouldn't have been able to eat. Under these circumstances, it's quite common for an abscess to get infected, with fatal consequences.
An infection of the gums, raw and throbbing right around the famous molar. Doctors at the time often pulled such teeth to lessen the pain. But what they didn't know is that if the tooth is pulled and the abscess bursts, infection enters the bloodstream. Without modern antibiotics, the consequences would have been deadly. Hatshepsut's last months must have been painful. A powerful queen, a pharaoh, wasting away in her bed. The infection eating at her gums. And finally, the rest of her too. This then is how Hatshepsut died, killed by her body's own infection. Ironically, from the very same tooth that would prove the key to her identification 3.5 millennia later. But if Hatshepsut was done in by disease, one question still remains. Who tried to erase her name from